So the next talk and the last talk in this session will be from Arash from Luke in Finland, talking about single-step genomic prediction, applying alternative SNP weighing.
My name is Arash Chegini. I work as a statistical geneticist in Luke Institute in Finland. And I'm going to talk about the multiple trait single-step genomic prediction of other health traits in Nordic Red and Jersey cattle, applying alternative SNP weighting. Clinical mastitis is one of the most costly diseases with high incidence rates in affecting both quality and quantity of production in dairy herds, and as well as animal welfare. Therefore, improving resistance to clinical mastitis would result in higher profitability and sustainability. Mastitis is a low heritable trait, so there are different strategies to improve this kind of traits. One could be to pool the records from different countries, similar to what is currently in practice in Nordic countries. And the other way could be to run or employ a multiple trait analysis, bringing into the indicator traits with higher heritability and higher number of records. And the genomic selection could be another option, which by shortening the generation interval and improving the accuracy of selection would result in higher response to selection and improvement. Genomic selection can be implemented in different ways. For instance, in SNP blob, we regress pseudophenotypes like daughter year deviation or direct rest proof on SNPs. Or in G-blob, we need to construct a genomic relationship matrix instead of numerator relationship matrix that we use in conventional blob. But there is a more advanced way or method namely single-step procedure that in which we combine all the records or observations or information from genotyped and non-genotyped animal in one step. However, all of these methods assumes that all the SNPs explain equal amount of genetic variance, which may not be true because some SNPs are closer to influential genes or in proximity with them. Therefore, we hypothesize that by allocating different or specific SNP weights, we will get improvement in prediction reliability. 70 million records for Jersey cows and almost 75 million records for RDC cows from different other traits, including clinical mastitis in first sterile lactation, somatic cell count, and also in first sterile lactation, and 2 other type traits only in first lactation were included in this analysis from 3 Nordic countries. We classified clinical mastitis and somatic cell score to different classes depending on the lactation number and the daisy milk in which the disease occurred. And here you see a summary statistic of studied traits. As you can see, the incidence rate of clinical mastitis was much higher in Jersey cows, especially in first lactation, almost 2 times higher than that of in RDC cows. And in RDC cows had better confirmation trait and lower somatic cell score. And the number of genotyped animals in this study were almost 140,000 genotyped Jersey and 250,000 genotyped RDC were included. but we only included those genotyped animals born after 2008 to be in the same line with Nordic cattle evaluation. And the number of SNPs after applying editing criteria were almost 42,000 for Jersey and 47,000 for RDC. You can see the type of the model that we used was a multiple trait random regression testing model. And with different fixed effect and random effect in the model. For instance, herd 5-year production period and year-month of production parity class, and a fixed regression on heterosis to consider the different bases coming from different Nordic countries. And also a fixed linear and quadratic regression on calving age breed was fitted. Also, random effects included herd year, animal additive genetic effect, permanent environmental, and residual random. As the somatic cell scores were repeated measurement, a fixed regression function on daisy milk nested within country parity year season of calving was fitted on somatic cell score in 3 lactations. And this was a complicated method, and it would become more complicated if I say that we used the covariance function. And we had 9 traits, but as we fitted a second low gender polynomial on somatic cell score, so we had 15 random components or terms in our model, and we applied a singular value decomposition and left or removed 3 of them, leaving 12 random components in the model. Doesn't work. It doesn't work.
The green, yeah.
We applied 4 different SNP weighting scenarios. The first one was nonlinear scenario introduced by Van Roden, Cole, and colleagues. Considering that to construct a conventional genomic relationship matrix, we need to multiply the SNP marker matrix by its transpose and divide it by 2PQ, which PQ are allele frequencies. To bring the SNP weights into the calculation, we need to construct or build a diagonal matrix having SNP weights on its diagonal. For the first scenario, we needed 3 different parameters to calculate the weights. A constant parameter here was 1.25 SNP weights and a standard deviation of SNP weights. The second scenario, instead of this formula, we used the classical formula introduced by Falconer and Mackey. And in third scenario, the average weight of every 20 adjacent SNPs calculated in second scenario was calculated and used. And in fourth scenario, we used the SNP variances calculated by considering annotations in a Bayesian framework using NextGP program. In fact, I received these SNP variances from Emre, the first presenter in this session. we needed some input file to proceed, and we used different softwares to calculate these inputs. For example, we use Relax to calculate the inbreeding coefficients, or T48 to calculate the centered SNP marker matches. And all the analyses were done by using a Mix99 suite program. And residual polygenic effect was set to 0.1. For candidate selection and validation process, last 4 years of phenotypic data were truncated to create a reduced dataset. And for both full and reduced dataset, we calculated the reliabilities. And in the next step, we used the reliabilities to calculate the effective record contributions by a reverse reliability approximation methodology. And then for candidate bulls, which were the genotype bulls with ERCs equal or higher than 2 in full dataset, but that of less than 0.001 using a reduced dataset. And I would like to mention that for clinical mastitis and somatic cell score, in fact, we combined their genomic estimated breeding value at the end. And this, we use these coefficients, which is now practically in use by Nordic cattle evaluation. For example, for somatic cell score, the GBVs in first, second, and third lactation were multiplied by 0.5, 0.3, and 0.2 respectively. Here you see the result of forward validation for clinical mastitis. For Jersey and RDC bulls candidates, and the regular or without applying any weight in single step resulted in prediction reliability equal to 0.65 for Jersey and 0.5 for RDC. And as you can see, all the SNP weighting methods resulted in higher prediction reliabilities. And the best one were those from, the best one was classical method, which is a straightforward formula to calculate and implement. 17% improvement in prediction reliability for Jersey bulls and 36% in RDC bulls were obtained. Also, using SNP weights, considering annotations, resulted in 12% higher prediction reliability for Jersey bulls. Corresponding results for somatic score are shown in this table. Here as well, improvement were obtained in terms of prediction reliability by applying different SNP weightings. And for example, the best scenario in this case as well was the classical method, resulted in almost 30% higher than the conventional single step without applying any weight. So as conclusion, I would say that applying SNP weighting as priors result in higher prediction reliability, and we expect that we get higher response to selection. And I would recommend to use this SNP weightings formulas for other breeds and other traits.
Thank you very much, Arash. One question, Emre, and then it's lunchtime. We have to.
No, it's not really a question, it's just a clarification, because the SNP variances I provided, they were from a much smaller subset of the data. But the rest of the weights that Arash used, it's from the full data they have. So we have to keep this in mind. And then the variances, again, I estimated per SNP, they are from a different SNP set. It's not exactly the same SNP set that he had. So, yeah, there are some differences that should explain maybe the differences between the SNP weightings. And another thing is that in principle, yes, anything can be used to weight the SNPs, but nobody, I think, has ever justified the use of these weights other than the SNP variance. Because I can see, when I look into theory, that the SNP variance is naturally there as a weight. But the rest of them, everybody uses, but I don't know where does it come from.
Which formula do you say? Classical
Any
method?
formula that is not the SNP variance, I don't know how to justify that as a weight.
But in a book, Falconer and McCain, 1996, you can find that formula. He said that, and with some demonstration, he showed that this can be used to calculate the SNP, not SNP variances, but the yes, a kind of SNP variances to pick you.
I'm not against that. I'm not against that. I'm not against that. I'm just asking if it can be used in a blob setting as a weight. Just I don't know. I have not seen. So that's
in a study conducted by Fragomeni and colleagues, he has stated that nobody used this and applied this weighting method on real data set. And the reason he mentioned was that this methodology does not lead to convergence. So that was why they didn't use it. But we used it and it converged.
I think the two of you grab a table at lunch.
Thanks.
And then thank you very much.